I'm joined now by Congressman Brett Guthrie of Kentucky, a good friend of Better Medicare Alliance and one of the 2020 Medicare Advantage Champions of the Year. Congressman Guthrie represents Kentucky's 2nd District, is a member of the House Energy and Commerce Committee, and that is where he serves as the lead Republican of the Health Subcommittee. And we're so grateful that he's here with us today. And welcome, Congressman Guthrie.
Thank you very much. It's great to be here. I really appreciate the opportunity.
Well, we appreciate it even more. Congressman Guthrie, you've been a longtime champion for seniors on Medicare Advantage, both in your district and around the country. And I just wanted to have you speak to why you see this issue being so important to you and why you believe it resonates with both sides of the aisle from your colleagues.
Well, thanks. Well, I'm just a big believer in choice. And I think that seniors, just because you turn 65 doesn't mean you should and have to go into Medicare, doesn't mean you should lose the choices of health plans, choices of providers. And so I always say that people trust their physician more than they trust their politician. I hate to say that being the politician, but that's absolutely true. And so people need choices to move forward. And then the other thing, so people can choose whichever side of Medicare that they want to move forward. But also Medicare Advantage, I think, just offers a superior product. You look at fee-for-service healthcare, I just don't think that's the way to go. It is the fee-for-service healthcare. Like I said, people have those choices, but it's taking care of symptoms, where Medicare Advantage offers all the wraparound services. And I think that's just important, that people have a choice. I can go on the old fee-for-service model, or I can go to the Medicare Advantage model, which allows me to still have wraparound services. Some of the benefits they're talking about adding in reconciliation are already available in Medicare Advantage, and some to most Medicare Advantage plans to some degree. So it just shows how innovative Medicare Advantage is and gives seniors the choices they deserve.
Thank you, Congressman. Congressman, as you and I are speaking here today, we're still at a time where the COVID-19 pandemic is continuing to impact so many of us. And with seniors, especially with seniors being the most effective. As the lead Republican on the Energy and Commerce Health Subcommittee, you've been at the center of Congress's response to the pandemic. What do you want our BMA audience to know about the status of the fight against COVID-19 today? And in what ways have you seen Medicare Advantage play a role in that response?
Well, as you know, COVID, the issue with COVID is, for a lot of folks, it's not as serious as it is. For others, it is extremely serious. I always say it's like Russian roulette. There were a lot of people that I know would say, oh, it's nothing more than the flu. And that's absolutely not accurate at all. Or it could be, depending on who you are. And as we know, I said it's like Russian roulette. So depends on how many bullets you have in the gun playing Russian roulette. And we know there are comorbidities, age being one. So everybody over 65 is already at threat with COVID-19. So it was extremely important for seniors to have the opportunity to have the vaccines, have the treatment, have the access. And I know all of the healthcare plans step forward to say, we're going to make sure, as we were developing what was the response going to be, what was the cost going to be, is there going to be cost sharing moving forward? All the health insurance plans step forward and say, we're not going to be an impediment, or we're not going to let money be an impediment to somebody over 65 receiving a vaccine, receiving the care that they need. Where we are currently with COVID, hopefully we're beyond a peak. As we get more people, as the thing that we absolutely don't know is how long does the vaccine last? And the other one is how effective are antibodies from previously having COVID. But if the vaccine plus the booster, and then you have all the people that recently over the Delta variant has had COVID, hopefully there'll be enough people moving forward as we see the peak dropping, that we're going to be able to work our way out of this COVID-19 situation. I've always encouraged people to get vaccinated, make it their choice. Also believe that people who've had COVID are probably going to have protections. And so hopefully we're getting more and more of the citizens of the U.S. immunized. The one we have to watch for, what about other variants that go against that the antibodies we've built up in our systems, either through having COVID or through the vaccine, aren't as effective towards? That's what we have to be mindful of. But hopefully we're turning the corner. It usually gets worse when the weather gets cold, so we'll see. But having the Delta variant in the heat of the summer, if you're ever going to have one, it's probably the right time to have it. And hopefully we have enough people with immunity now.
Well, and thank you for that. And hopefully we will see that turning that corner that you're referring to, and appreciate your leadership and continuing to watch that issue. I did want to turn to reconciliation. As you know, Democrats in Congress are continuing to work on the reconciliation bill, and the Better Medicare Alliance, as a nonprofit organization, we engage with Republicans, Democrats, and independents who hold a range of views on the legislative package. But protecting Medicare Advantage beneficiaries in the final bill is important to us. And as an alliance, we're not opposed to adding new benefits in fee-for-service Medicare, but there's particular interest in ensuring that it's not paid on the backs of Medicare Advantage beneficiaries. What's your prognosis on the status of the reconciliation bill today? And what do you say to Medicare Advantage beneficiaries who want to know how the final bill may impact them?
Well, thanks. So one, on the current status, I had a long conversation with a couple of long conversations with a couple of good friends of mine who were members of the Democratic Party, and they didn't know. So I'm not sure anybody really knows the status and what's going to move forward. You have a couple of things. One, they have to agree on the top line number. And once they agree on the top line number, is it going to be 1.5 trillion or 2 trillion? Then what are the 1.5 to 2 trillion that comes out of the program? And then, or are they going to use gimmicks and keep all the programs in there, just start them, you can use gimmicks to try to make it fit under the other moving forward. The other thing is a couple of senators that are going to be absolutely critical to voting for this. One from Pennsylvania, one from West Virginia. The Pennsylvania person, I'm not sure where his situation is, but West Virginia, a big part of this is the Green New Deal. And if you would say that Joe Manchin would vote to essentially put fossil fuels at a huge disadvantage, because we all want less carbon in the atmosphere, but we can do it. But are you going to destroy the economy of your own state to do that? And then if you're from Pennsylvania, are you going to put a methane tax on the wells of West Pennsylvania? I mean, those are things they still have to work through, and I'm not sure how they get there. Most people say they'll figure out a way to not fail, but I'm not sure what the final package is going to look like. And you're right. I brought this up during our hearing. Medicare Advantage isn't specifically disadvantaged in the bill, but by adding the fee-for-service, the way the benchmark system works for the benefits to fee-for-service can disadvantage Medicare Advantage. We brought that up. As you know, Medicare Advantage has a bipartisan support across the board, but there's 100, well over 100, which is a majority of the members of the Democratic Party who voted for, who have co-sponsored Medicare for All, which isn't Medicare Advantage for All. It's fee-for-service Medicare for All, which essentially eliminates Medicare Advantage. And so when you have such a large, even though there are a lot of bipartisan support for Medicare Advantage, if the train started moving down the station to disadvantage Medicare Advantage, we've seen that with Medicare Part D, which uses private health insurance to provide prescription drugs moving forward. And instead of us sitting down in a bipartisan way, which we can, and there's bills out there, I'm not just saying this, there's proposals out there that are bipartisan to deal with drug prices for everybody. They've chosen to really just put a disadvantage to Medicare Part D in terms of getting drugs, in order just to fit a philosophy of a program to expand the Medicare that we're talking about, and also to create a Medicaid national program. So even though Medicare Advantage has bipartisan support in the House, which it absolutely does, you still have to be vigilant, because some of these, as we say, the train starts leaving the station. A lot of people who you think would be for you just jump on the train because that's the train leaving town. So you have to be very vigilant. And I wanted to make sure we had our hearing that people understood that Medicare Advantage is a critical way to deliver healthcare to people over 65. And this could be a first chip in the armor to start whittling away at Medicare Advantage, because there is definitely, if you have, I think it's 117, if not more, members of when there's 220 members, maybe it's more than that. I think it's more than that. Actually, I have 220 members that have signed on to get rid of Medicare Advantage, which you can't say it any other way. I know they say, well, in the end, we'll come up with something, but that's not what the bill says. Then you have to be vigilant as this process moves forward.
Well, and Congressman, I want to thank you for what you've been doing recently in bringing up that Medicare Advantage at those hearings. And to your point about being vigilant, is there suggestions that you can give us about just feedback on, do you feel our messages are breaking through on, who the Medicare Advantage seniors are? Our beneficiaries are proportionately lower income. They have the chronic conditions. They possess the higher rates of social risk factors. Their coverage is provides a meaningful health and financial security. And we're just trying to make sure that that's breaking through to policymakers. Do you think that is? Do you think there's more our organization and grassroots advocates can be doing to ensure that it's being made clear that Medicare Advantage is the lifeline for these seniors?
You can't rest. You can't rest, and you do have to move forward in the most effective way. If you have your members, your clients, contact their member of Congress and make sure that they know it's not just coming from people in Washington, D.C. who are representing health insurance companies. It's coming from people who have the care from those health insurance companies. Because there used to be a
Really about
misperception, and I
hearing
think it's
directly
getting
from the allies, from the beneficiaries.
absolutely. You could have the most powerful, law firm or firm in Washington, D.C. representing you, but nothing's effective, and as it should be, than people who live in your district and grassroots reaching out to members of Congress. And so, it used to be thought of, I think, the perception of Medicare Advantage, and it's changing, is that it was a upper middle class kind of entitlement that's subsidized by the federal government that cherry picks. And if you look at the way healthcare is in a lot of areas set up, that was what the risk would be, but it's the absolute opposite. It is the wraparound services that people with chronic conditions get because they have Medicare Advantage that is so important. And I think that people understand it, but the more people that understand it, the better you are, that it truly serves the needy, it surely serves low income, and more important, it gives services to chronically ill that Medicare fee for service is just not set up to do.
Thank you. We really appreciate your advice, and we'll continue to be vigilant. And we, as you are here, speaking with us now, to our allies and beneficiaries, will continue to rely on their voices. We just have a few minutes, and the last question I wanted to turn to, Congressman, relates to the bipartisanship and the support that we have for Medicare Advantage that you referenced earlier, and that we are often in a partisan environment here. Despite the threats to Medicare Advantage beneficiaries, depending on which policy scenario the program faces, that we want to continue to rely on that bipartisan support and continue to reach out to those members to maintain and build that support. Why is it, in your view, that Medicare Advantage has been able to, defy the trend of partisanship and been able to, receive the bipartisan support that we have received? We recently, Congressman Val Demings did a bipartisan letter. Also, we're grateful HHS Secretary Becerra earlier this year made positive remarks about the importance of preserving Medicare Advantage. Why do you think there is this trend of bipartisanship on Medicare Advantage when we are in this partisan environment?
Well, I think one is that who you serve. I think all of us, we have people in our districts that receive their Medicare through Medicare Advantage and are satisfied with it, are happy with it, who've made the choice to go through the Medicare Advantage program and see the services. The other thing is educating members that it's not, I remember when I first got there, if you remember, the Obama administration really came after Medicare Advantage, and under the simple slogan that headline, because you've got to read the details of this is just subsidizing health insurance companies. And that's not what it is. There is a subsidy to health insurance companies, but it's to make the services you provide affordable to everybody over 65 that chooses to have that. And when you really start sitting down and saying chronic people don't need fee for service, chronic people need wraparound services. And what's interesting about it, and the fear of ever going to a Medicare for all single payer kind of program, is your Medicare Advantage plans compete against each other to get customers. In doing that, you have to offer benefits that are what the customer wants. You have to offer benefits in a way that they can receive them. And so I think it's made Medicare for people over 65 more robust and better and more thorough, because one, you compete with each other, and two, you reach out. And so the way that the most effective way, I would even start looking, some people are wedded to the idea of a single payer, and that's just their ideology. That's where they're going to go. But I would dare say that a lot of people who's co-sponsored the Medicare for All bill probably don't fully understand that it eliminates. They just think we'll have Medicare as it is, but everybody can buy into it. I don't know if they understand that it fully eliminates Medicare Advantage.
Mm-hmm.
And that's what we need to make sure people understand, because if you have as many people sign the Val Demings letter, as you said, and you look at the math has to be, there have to be people on her letter that are also on the Medicare for All bill.
Mm-hmm. Mm-hmm.
And so I think those would be good people on her letter, Medicare for All, to make sure to target first and foremost, to make sure they understand that one isn't compatible with the other.
Mm-hmm. Mm-hmm. Well, thank you. And Congressman Guthrie, thank you for your time today. Thank you for your leadership. Thank you for what you did on leading that bipartisan congressional letter. We could continue to talk to you on so many different issues related to Medicare Advantage, but we want you to know that we're efficient with your time, so you'll keep coming back, and we can continue to count on you as a champion. And thank you for your leadership in Congress. And on behalf of the 160 ally organizations and 600,000 grassroots beneficiaries here at the Better Medicare Alliance, we're just so grateful for your leadership and support.
Well, thanks. If you continue to offer services that millions of Americans want at the price they can afford and give them what they desire, I'll always fight in your corner, because I'm fighting for them.
Well, thank you, Congressman Guthrie.